Okay, so hello everybody. Thank you for joining today. Sanjeev and I will run this webinar. As I mentioned a minute ago, it's a quiet one today, which is great. So what we might do it in a slightly different way. So is there anything in particular that anyone on this call wants to go through today? Obviously, you've registered to have a look at our products, but is there anything in specific? Do you want to just pop something in the chat, or are you happy for me just to start running through our products, and then you can jump in with questions, just pop them in the chat as we go along, and we can stop and go through those. So is there anything, if you want to pop something in the chat? Okay, fine. Okay, good stuff. So I'm going to start now. I'll start with our first product, normal pathology management. I'm going to just move this over here so it doesn't disturb the screen. So can you see my screen, Sanj? Can everyone see my screen? Yeah, okay, good stuff. Okay, so I'm going to give with all of our webinars, what we found, and we run a lot of them, is that generally people want to ask questions because you need to validate how the tool will work in real life. So please don't hold back from questions around the practical usage of how MyBotGP will be integrated into your practices or PCNs or whomever. So the first tool that we're going to run through, and I'll run through them one by one, and then we'll stop for questions, and then we'll try and finish a bit early, 5 or 10 minutes early, so we've got so we can go through any additional questions that people have, and we can go back and forth a little bit if so. So the first tool that we're going to run through today is our pathology management tool. All of our products are called MyBotGP. The business is the company is called JIFJAF, and our product range is the MyBotGP product range. The first product we're going to run through now is our automated normal pathology check and file platform. The tagline for this tool is "Not all normal results are normal for the patient," because at first glance it could appear that our tool is a very straightforward mechanism to file normal pathology tests. Now, all normal pathology tests that come in from the labs to GP practices, despite them being normal, doesn't necessarily mean that that's the end of the exploratory work for the patient. So one of the reservations is that if someone just files all of the normal path tests, you might miss patients who actually have had a normal path test result, but they may be on a medication or have a health condition, or that normal may have been phase 1 in the exploratory work to determine what the issue is with the patient, and you would have wanted to see it. So to make it clear, this is not something that we haven't thought about. Our tool will actually run additional checks on all of your pathology tests as well. So you can set rules up to say file my normals if they come back as normal from the lab, because invariably I don't need to look anymore if that test comes back as a normal. However, if this particular group of tests come back as normal from the path test, I want you to go back in the patient record and look for percentage increases or decreases. I want you to check in the patient record for medication or health conditions. I want you to read the pathology report to look for warnings or percentage increases or decreases. And then what would happen if it is MyBotGP would if it picked up any of the additional checks as a fail, i.e. this has come in as a normal, but the patient has a health condition, it will fail that test and make it and highlight it so you know it's there. So what happens is we've actually created a system that adds additional safety, patient safety. Invariably, all of your path tests will run through MyBotGP, and MyBotGP will enforce additional checks where applicable and defined by the practice on absolutely everything. So you have the opportunity to go nuts, for want of a better word, and every potential additional check that you would like to run on a pathology test can be done for you by MyBotGP in the background. And obviously you can enforce rules, enforce standardization, minimize mistakes, because you have a machine doing this now, not people. So who are we? A couple of minutes on who we are. What MyBotGP does, it reduces practice costs, so you can allocate funding to patient care. It processes work faster, so you have more time for patients. Improves patient care and safety by enforcing fixed rules, quicker processing to identify issues, and minimizes mistakes. So a little bit more about who we are. We are actually an NHS ICT partner and experts in primary care automation and AI. Now, the reason why it's important that we're an ICT partner, we're a private UK business, but we are an NHS ICT partner. The reason why that's important for you is it means we have access to our own NHS cloud. And what that means invariably for the practices is we have very clean DTACs, DPIAs, data sharing agreements, and everything is locked down and fully secure as per NHS guidelines. So we can onboard practices and support practices very quickly. We're now supporting hundreds of practices across the UK, federations, PCNs, and we're experts at working with EMIS and System 1. Now, our first tool that we're going to run through now is our normal pathology management, safety and compliance tool. And the safety and compliance around that is I can confirm that it has medical device certification. It's also DCB 0129 certified. For those of you that aren't aware of what that is, it's an NHS prerequisite for certification. And just to tick off what I mentioned before, MyBotGP resides in NHS Cloud through HBL ICT, so DTACs, DPIAs, and safety is all assured. So move to the next slide now. This is not necessarily focused at primary care, at pathology tests. This is just a slide to try and help you see how time can pass very quickly, because as people we're not very good at reconciling or recognizing how long things take. 5 minutes in the morning, 10 minutes in the afternoon, 5 minutes in the afternoon, 10 minutes in the morning, 15 minutes a day doing something doesn't feel like a lot of work, but actually for one person 15 minutes a day equates to 91.25 hours a year, which is unbelievable. So 15 minutes a day equates for one person equates to 91.25 hours a year. So daily tasks take a lot longer than what you think. An average working week is 40 hours, so that's over 2 weeks work for one person. 30 minutes a day is 4.5 weeks. So when you start thinking about something like pathology management at a practice is managed by multiple clinicians. And the current stat that we have from our clients is MyBotGP will give each clinician back up to 30 minutes a day. So that's MyBotGP will give 30 minutes a day back to every clinician at your practice. And then it's a question of what you're going to do with that time. Obviously, quicker processing of results, focus on work, on patients that require proper, further, more complex investigation, and you can reallocate that clinical cost potentially to other areas of the practice, which can add more value to your patients. So, current approach and MyBotGP enhancement. So we've used an average practice with a list of 8,500 patients as an example, and 5 partners. So on average, a practice with 8,500 patients and 5 partners will receive approximately 200 pathology tests every day. Current NHS stat, give or take. That's a staggering total of 62,400 pathology tests a year. Now, see that, and so essentially, if you think about this 8,500 list practice with 5 partners, each clinic, every single one of those 62,500 pathology tests will be manually reviewed by the clinical team. Normal or not normal or abnormal. Normal needs additional checks to see if normal. Normal just needs to be filed, or abnormal requires further investigation and to kick off multiple various protocols to make sure patient is looked after. So all path tests sit in 3 buckets. Normal, no action, i.e. it's come back from the lab and it's normal, it could just be filed, you don't need to do anything else. Normal but might need action. Again, you might need to go back into the patient record and double check something to see whether that can be filed away without action, or it needs to be flagged because you need to continue looking after the patient. Or abnormal. Our tool in its current format looks after the first 2, all normals, and normals that need further investigation to decide whether they can be dismissed or flagged. So all path tests are vetted for safety and time saving. All of the normals will be filed, And all of the normals that come in but might need further investigation will be further investigated by MyBotGP by itself. It's fully automated, runs 7 days a week, 365 days a year, and then they will be filed or flagged. So invariably what we've done is we've removed this very repetitive, time-consuming chunk of work from the clinical team to ensure that they are just left with the stuff that they need to look at, in addition to ensuring that all path tests have a second sweep for safety to make sure that nothing slips through the net. Now, I'll cover the rules off in a moment. So MyBotGP supports patient care and clinical pressures. So, ensuring additional checks on all tests is an improvement on safety. Standardization and cover for holidays. Lots of our clients are very happy that they can set up standardized rules for the practice. Doesn't matter when people go on holiday or locums or cover or other people in the practice. Those rules are followed as the initial sweep. So you have standardization and enforced rules. And obviously help support reducing clinical fatigue. Now, coming back to the business case, unbelievably, if each partner is spending up to 30 minutes every day doing this task, based on this just one practice with a list of 8,500, which is an average size practice at the moment in the UK, and 5 partners, each partner will get back 19 days time to work on other things. So for the practice, that's a total clinical time saving that can be reallocated elsewhere within the practice of 95 days. So it's 95 days a year, and current, which is 16 weeks. Current cost for that is approximately £50,000. Now, our tool is retailing for an 8,500 list for somewhere in the region of £3,500, £4,000. So I'll come through to the rules now. So MyBotGP. Filtering and filing rules. Not all normals are a normal. So this is the crux of the platform in terms of the rules that you can employ, you can use to validate path tests. So you can combine. So it works 365 days a year and is used by practices across the UK to look after over 200 different pathology tests now. You can combine any of these rules to validate pathology tests results and what they mean for practices, for patients, then file or flag. So rule number 1, do you agree with the lab? Quite straightforward. So a lab will send a path test back with minimum and maximum ranges. Okay, so lots of our clients will say, yep, for particular tests, we use the lab ranges. We're happy to file on those. Other clients will look at some path tests and say, well, actually, we want to supersede the lab ranges. So you can supersede lab ranges. So for something like prostate, if you wanted to put 5 ages and 5 ranges, you can supersede 1 lab range if you get it from displayed like that from your lab. Lots of our clients do different ranges and check against previous test results and check for medication for some renal tests we've seen, which we'll cover, and we'll show you some examples in a moment. But you can essentially supersede the lab ranges. You can ask MyBotGP to compare tests against previous test results. So it will pick up the test, and you could say, yeah, I'm happy to file this as long as it's not gone up by 5% or down by 5%. MyBotGP will do that calculation for you for that specific patient by itself in the background. MyBotGP can also read the patient history and the pathology report to check for medications or health conditions in the patient record. It can also check for warnings or messages on the pathology test report as well, as lots of pathology tests will have warnings or messages on there. HbA1c might say diabetes or pre-diabetes, and you may want to flag that or file it anyway, depending on whether it's in range or out of range. Obviously, you can separate off in terms of age and gender. You can omit patients as well, and nothing is removed from your system. So if you're using EMIS or System 1, there's no need to panic. There will still be the same audit log in EMIS and System 1. Everything is still filed in the patient record. However, in addition to that, you will also have a full and comprehensive audit from MyBotGP as well. So you can very quickly look up the last 2,500 or 3,000 pathology tests in relation to what the patients, the results, and the logic that was used to monitor against them. Now, for those of you who still send text messages, you're also able to send text messages if you want. through the platform, and that just plugs into your existing version of AccuX. Works in exactly the same way. So essentially, you can combine any of the following rules. So if you look at something like prostate, what we can share is lots of our clients use a combination of all of these rules just for prostate. So they will set up 5 ages and 5 ranges, so they supersede the labs. However, they put an additional safety in there to say, look for in the patient record, and if the patient has had cancer or prostate cancer, metastatic cancer, even if they pass the superseded lab range, still fail that, because I want to see that test, because presumably they should have been on 0. Other clients say, no, I want to use the lab range if the lab is using one range. However, a fail is a fail. However, if the patient passes and they are within range, I want you to do an additional check on the patient record, see if they've had a test before. And if they have, if it's gone up by more than 5% or 10%, I want you to flag that, because the rise is too quick. So that was more popular sort of year and a half ago. We seem to see more clients now using 5 ages and 5 ranges, but the reason I share that is just to show how flexible the platform is. Now, for those of you that are linked to PCNs or soon to be neighborhoods or federations, this tool is bespokeable at practice level. So why that's important is if you are part of a PCN or a Fed and everyone has their own EMIS or System 1 and they are working independently, everyone can have their own copy and they can apply their own rules, because different partners will have different opinions on what rules to add to validate path tests. So there's no restriction on there. There's obviously also the option, if you're centralizing everything, to have one copy of MyBotGP, one set of rules, and then you can enforce some standardization across a PCN or region or number of practices. There's flexibility to work either way. Okay, so before we move on to the next slide, which I'm going into here, I'm going to show you the configuration page, and then I will show a quick snapshot of pathology tests, and to show how some examples of what our clients are doing. So you can easily set your pathology test rules. What happens is MyBotGP will suck up all of the ranges from your labs, save them in the memory, and then you quite easily open up each individual path test. So the one I'm showing here is a liver function test. For this example, the scenario is that the lab is using these ranges, and you can see the ranges here. So what you would do is you'd look at that, and the first decision is say, well, do I agree with the lab? And am I happy to file this path test without additional checks on it if all of these are within range? If the answer to that is yes, then you would click File for Normal Report. And the next time MyBotGP sees a liver function test, it's going to look in its brain and it's going to say, yep, I've been given permission to file this test as long as none of these are a fail. And if none are a fail, it will file it. If any are a fail, it will fail it. Now, let's say, for example, you don't agree with the lab, or you want to enhance these ranges with additional checks. Well, then you wouldn't tick File for Normal Report. What you would do is you would simply change some of these ranges if you want to. You just click here and change the range and press Save. Or you can say to MyBotGP, I'm happy with all of these as long as this one hasn't gone up by more than 5% from the last test. So you just, where it says previous test result, you just click yes, and then you put the percentage increase or decrease here that you wanted to put as the safety check. And here is where you can add keywords or check for keywords. What we mean by keyword is it's just a generic term for any word. So here is where you would say check if a keyword is absent or present or in the problem page. And here is where you'd put the medication, health conditions, or check for warnings on the pathology test report as well. Lots of path tests don't have ranges. They might say positive, negative, detected, not detected. You've got microbiology tests as well. So MyBotGP can read all of those and pick those up as well. And then there's your filing, comment with your filing string. So file with or without comments. Okay, so what I'm going to do now is I'm going to share a spreadsheet. Hopefully this was all emailed to you before joining. But what this is an indicative snapshot of pathology test rules. So So you may have different opinion on what rules you want to add to this, and that's fine. This is just an indicative snapshot, but it's a good way of showing you in real terms how clients are using the tool. So I believe this has 181 different pathology tests on it. And what you're looking at here, enabled means they've given it permission. Path test name, subtest name, age, gender, check for normals, ranges, check against the previous test result, keywords, comments and filing strings. So essentially what you're looking at here, if I just go back to this presentation, here are the rules. Agree with the lab, supersede the lab, compare tests against the previous test result, check the patient history, check the path report, separate ranges for gender, age, omit patients. So if you look at the first test here, which isn't a test you're going to be asking for thousands of a year, but it's just the first one. It's a nice example. It's called a 24-hour sodium test. Subtest is 24-hour urine sodium. This particular client doesn't have a preference on the result in terms of age or gender. They want to use the range of 27 to 287. They're not interested in checking against the previous test result. They're happy to file as long as the client is within range. However, before filing, they want to go back into the patient record, and where you can see the keyword, and they're displayed here, they've asked MyBotGP to do a double check in the patient record to see whether they have diabetes or chronic kidney disease. And then they've said don't file it. If they do, flag it, because they want to continue the exploratory work with the patient. When you look at something like prostate here, with the example that we gave before, prostate here, you can see this particular client has chosen to supersede their lab ranges, and they've set up 5 age ranges: 18 to 39, 40 to 49, 50 to 59, 60 to 69, 70 up. And they've set separate ranges, 2.5 ranging up to 6.5 for each individual group. So they're saying to MyBotGP, ignore the lab. I want you to check these ranges for these ages, and if they're within range, I'm happy for you to file it. However, before filing it, as I mentioned before, go in the patient record, and where you can see here where it says keyword absent in the problem page, look for the words prostate cancer or metastatic prostate cancer, because if they're in there, I don't want you filing it, even if they're within my superseded range. I want you to fail that. Something like HbA1c, happy for you to file it. This is what this particular client has said, 20 to 41. However, I want you to check for diabetes or pre-diabetes. EGFR is another one. Again, I've only got one example of that here on this particular spreadsheet, but what you're looking at here is this client has said 90 to 120, no keywords checks. I've seen that at 60, I've seen that at 70 to 120, I've seen one client, I think, say 70, and then check against the previous test result if it hasn't gone up by more than 5%. I've seen clients say file it as long as they're not on a particular medication. I think it's called methotrexate. So there's all different versions of that. So the keywords are super powerful in terms of validating whether you can just get rid of that test without looking at it, or whether you need to flag it. You can see here diabetes, pre-diabetes, AKI, CKD, all the way through here. Setup is really quick. A couple of hours to set the tool up. We'll help you do that. And then MyBotGP runs 7 days a week. 365 days a year. It will email you an audit at the end of each day saying what it's done to whomever you want it to, and obviously there's a more comprehensive audit log in the platform as well. So before I move on, do we have any questions? Sanj, has anyone put any questions in the chat? Or would anyone like to put any questions in the chat, or no? Just wait a second longer. Oh, okay, thank you. So we'll move on. So then we come to reporting. Super comprehensive audit log, as you would imagine for a tool like this. Without going into masses of detail, we could spend half an hour just on the audit log. Everything, there's a footprint of absolutely everything. All path tests, link back to the patient, all anonymized. Obviously, you'll be able to see the actual patients. We can't see the patients, but there's a full breakdown of everything. So you can go back at any point and see what's been done, and obviously we send you a daily tracker as well. Pricing is quite straightforward. This is based on an individual practice. MyBotGP pricing is all of our kit is based on unlimited path tests and volumes. Fixed price 749, and then list times 30 pence for MyBotGP. And then we have the NHS cloud provision that's charged based on how many patients you have. 1 to 10,000 patients is 7 pence a patient. 10 to 15,000, you'd pay 6 pence on the difference, and 15,000 and up, 5 pence on the difference. We can go into more detail on that after the call, but an example calculation for this 8,500 list is you're looking at a cost of 3,887 plus VAT on an annual subscription. When you come back to the original, and obviously second products, there are discounts. When you come back to the first slide where we're looking at here, the business case, 95 days a year of clinical time allocated to this task, and you will obviously have enforced standardization, enforced rules, something done 7 days a week, 365 days a year. Okay, any questions before we move on to the next product? Just wait a second longer. Okay, so no questions. So I'm going to stop sharing my screen for a moment. I'm going to close this brochure and then we'll open the next one. Give me 1 second. Okay, so I will reshare my screen. 1 moment. Over here. Okay, can you see my screen, Sanj? Yeah. Okay, good stuff. Thank you. So this is the second product. This product is just for EMIS clients, as EMIS clients will be invariably will be using Document, and you must be using Document to use this tool. Okay, so I'm going to move on to the next slide, which we've run through. So the only difference on this slide is this tool is not a medical device. However, it doesn't need to be. However, it does have a DCP 0129 certification, which it does need to have. Same principle as before. It's there to, MyBotGP is there to help reduce practice costs, so you can allocate funding to patient care, process work faster, so you have more time for patients, and help improve patient care through enforced fixed rules, quicker processing, so you can identify issues faster and minimize mistakes. This is also delivered from NHS Cloud through HBL ICT, obviously through our hosted environment. We did this slide before, but same principle. Letter management takes a lot longer than 60 minutes a day. And there's definitely more than one person involved. So if you think of multiple people, just like a GP practice, just like with pathology management at a practice, all having to be involved in the validating, filing, actioning, or not actioning, or triaging off of letters, you're looking at multiple people. So we use this 8,500 list again as an example. So there's some correlation with all of our brochures. Current NHS stats say that this list practice, just one practice with 8,500 patients, will receive about 125 letters a day, which is 39,000 letters a year. Massively important work that's led by practice teams, very time consuming and often error prone. With 39,000 letters a year, it's impossible, even at a 5% error rate, and I believe the error rate is actually higher. That's a lot of mistakes. All letters must be filed and coded. What does that mean? So it means all letters have to be validated in terms of what they are, i.e. A&E, trauma and orthopedics, ENT, and they need to be filed against the patient record. Someone is doing that. Every single one. In addition to that, Some letters need to be clinically coded. So what I'm saying is a lot of letters just need to be validated, got onto the system and filed. All letters need that. However, some will need to see specific people, and some letters don't need to be seen by anyone. They can just be filed and validated, got onto the system and filed and dismissed. So what MyBotGP does, again, it works 365 days a year. It helps minimize the impact of holidays, sick leave, busy periods, files all letters and ensures they get to the right place quickly and by itself. And it will reclaim approximately 203 days a year based on this average practice of 8,500. No backlogs, remove errors, and enforces best practice. It's essentially a document super user. What it doesn't do is make medical clinical decisions based on reading the letters. That will still need to be done by the appropriate people. There is no tooling out there that can do that completely by itself, and there won't be for quite some time in primary care. Just too expensive. So what's the challenge that we're trying to crack here? What we're saying is you have highly specialized, overworked and busy teams already that should only be looking at very specific letters, the letters that require further investigation or actioning. What we're doing with MyBotGP is making sure that that's all you look at. You don't have to do anything else. Everything else is dealt with in the background. And you get time back. So think of it as an automated letter management document super user. So it's going to recognize all of the letters, okay, and then it's going to complete the document template for you, which is the template on the right hand side. So it's going to pick up the letter, it's going to read the letter, it's going to work out what the letter is, and then it's going to complete the document template, which means you can get it onto the system, and then it will file it against the patient record. And it does that completely by itself. We will train it for you, and then it will pick your letters up, read them, say, yep, I've been given permission to manage that one, complete the template, file it. So it's going to collect all of the letters and emails from document. It's going to read them and it's going to complete the document template by itself. It's going to validate the patient, the letter. It's going to code the letter type and file it. It's able to recognize what date to use, which hospital name on the letter is the correct hospital name to use, all of the stuff that people have to do at the moment. It can recognize NHS and private letters, so it can cope with the private letters. We've lots of our clients saying they're getting lots of the weight control letters, private referrals coming through, which is quite time consuming, so it can pick those up as well. So essentially it works 365 days a year, and you've got this highly specialized team now that doesn't have to do this task anymore. So what's phase two? Phase two is now that you've done that, what do you want done with the letter? So we get to the right slide here, a bit of fight with the presentation. Here we go. All practices have got different letter management flows that are actioned through document. So what does that mean? Well, it means that every practice, based on how they want to manage their letters, will have a slightly different flow. Some will want clinicians to see some letters, others won't want clinicians to see some letters, some will have coding teams that can make clinical decisions, others won't. Some will want to action some letters. So as with all of our products, MyBotGP will be bespoke to how you want it to work. So it will file and code all the letter types, and through document already, it can use all of your folders. You can set up new folders, you can triage usual GPs, you can use all of your templates or set up new templates. You can send letters to coding teams. You can tell it, hide letters. These particular letters, we don't want them visible on the patient as a default. It will do that as a default so they don't slip through the net. And you can set tasks. So we've got the two things. We've got pick the letter up, validate the letter, get it on the system, file it against the patient record, all done for you. And then phase two is then what you want done with the letter. So some letters you just don't need to see. Negative retinopathies, 111s, DNAs, they can just be filed unless there's a warning on there that means you do need to see that letter. It can check for warnings. So that's several thousand letters a year just gone, just filed onto the system, validated, that you don't have to pass don't have to pass through you anymore. If your practice is linked to a pharmacy team, all pharmacy letters you can highlight and say, look, just file these, get them on the record, validate them, and put them in a box for the pharmacy team, or push them through a template. It can do that. So there's several thousand you don't need to look at anymore. They're gone as well. And the remaining letters that do need to see specific people, some of our clients like to push them through templates, others put them in particular folders, others triage to usual GPs. You just tell us where you want them and we'll set it up so it will send them there. So the time saving essentially is in the validation, the pickup, the validation, the filing of these 39,000 letters a year, then the removal of the ones that you don't need to see, and triaging to the appropriate place or people or teams of the ones that you're left with that do need to see. So yes, you will still need to read the letters and make a decision based on those letters. There is no AI yet that can supersede a human safely in that. That is still with you, but you're not doing anything else and saving a massive amount of time. No more queues of letters, of unfiled letters. So full audit log, obviously, goes without saying that this kit has a very comprehensive audit log, as with our pathology management platform. Every letter filing by date, by category, all broken down, so you can see at any point what's happened, what letters have come in, have been processed, haven't been processed, and so on and so forth. Training is quite straightforward. What we do is we train the letters for you now. We only sell this tool with us training the letters. That we have training webinars and training channels that you're welcome to join as well. So once we hand the tool over to you, if letters change or when letters change or we get new letters, you're able to make those adjustments yourself. We will validate all of the letters. We will tell it to recognize, teach it to recognize all of your letters, because each practice will have different letters from different hospitals. They will look different. They might have different actions on them. And then we book a call with your team and say, right, where do you want them? Where do you want us to send them? Coming back to this slide here, and we'll organize it. So, and we'll tell MyBotGP where to send them, and then we move away. With the audit log, it will show you what's done every day, and it will also show you new letters it's never seen before. And that way you can adjust them, tweak them, change them, get them onto the system. So the way that we charge for this tool is quite straightforward. All of our kit, we have an annual subscription for, unlimited letters, unlimited volumes. Pricing is the same, other than an additional configuration cost, but it's the same pricing model, 1999 plus list times 30 pence for MyBotGP, and then for NHS Cloud, depending on how many patients you've got, there'll be an additional charge of, if you've got up to 10,000 patients, 7 pence a patient, 10 to 15,000, 6 pence, or 15,000 upwards, you pay 5 pence on the difference. That example calculation based on a practice with an 8,500 list, it comes in at 5,137 for unlimited letter types and letter volumes. And again, discount on a second product acquisition. Okay, so just quick summary of where we've gone with our pathology management, with our document management platform. Do we have any questions? I'll wait another second for that. No questions to put into the chat? No? Okay, fine. Good. Okay, so what I'm going to do then, it looks like we've got through this quite quickly and there aren't questions, is I'll do a quick summary of our two products. And then if anyone's got any questions, please jump in. If not, we will close this off, and then we will circulate the webinar afterwards. And if anyone's got any questions afterwards that they want to ask directly, please do. So coming back to who we are and why MyBotGP exists. MyBotGP is an automated platform delivered from NHS Cloud. We have a very simple purpose. It reduces practice costs so you can allocate funding to patient care, processes work faster, enforces rules. Our pathology management platform is a medical device, classed as a medical device, DCB 129, 160, and what it does is it will take over the management of your pathology tests for you. It's going to pick up all of your pathology tests will run through MyBotGP. It will use EMIS or System 1 as a user. in exactly the same way. And it's going to look at every single test for you before they get to you every day. And all of the normal pathology tests, it's going to have a look at and say, Matt, do I need to show that to a clinician? No, it's normal. It'll just be filed. Don't need to waste their time. And then for the normal pathology tests where you clinicians would like to see that path test because it will trigger that they need further investigation in the patient record, it will do the additional checks by itself, fully automated in the background, so that that happens by checking the patient record, or the pathology test report for keywords, medication, health conditions, percentage increases, decreases. Obviously you can supersede lab ranges as well. So all of the normal will be files, all of the normals will have additional checks on them where required, and you will free a significant amount of clinical time, in addition to improving safety and standardization of the practice, because this is a machine. It's running thousands and thousands of times. We're processing thousands and thousands of path tests a day. It's going to run in the background and it's going to do this for you. It's not going to get bored one day or make a mistake and omit double checking something. No matter how small the risk to the patient, it will always do that. So you can set up, what our clients do is they set up every permutation of every additional check they can possibly think of and turn it on and let it run in the background to ensure that they're presented with what they need to see. Our rules are very comprehensive, self-configurable. You can log in and out, change them at will. Agree with the lab, supersede the lab, compare tests, percentage increases, decreases, age, gender. You can tell it to omit patients if you wanted to. Nothing is removed from the system as well. Self-configuration, really easy. Open it up, double click, click a few buttons, and it's done. Generally speaking, our clients, about 2.5 hours to configure the platform over 3 to 4 weeks. Most practices will prefer to set up one pathology test, sort of 10-20 pathology tests to begin with, let it run for a week, build some confidence, then add another 20, let it run for a week or two, build some more confidence that the tool is working properly and they get used to understanding how it works. And then by week 3, week 4, we see just shoot straight up. So if you're getting 125 path tests a day, MyBotGP will be doing an initial check on probably 100, 110 path tests a day for you by itself, and making sure you're only left with what you need to see. Document, our other tool, again, there isn't anything out there that will make a medical decision after reading a letter for you and then action that medical decision. So what's the answer? Well, the answer is to remove all the rest of the work so that those people are just doing that and not anything else. MyBotGP will do that for you. For our document product, is going to pick up all of your letters, 39,000 letters a year on an average site. It's going to read them, it's going to complete the document template for you by itself, validate the letters, code the letters in terms of letter type, name, file them against the patient, and then send them where you want them sent to the appropriate people or teams, or not, bringing a significant amount of clinical time, and full audit logs as well. So that's our products run through. We've done that super quick. I'm just going to stop again now, stop sharing, and ask if there's any questions come into the chat. So now's the time if you have questions. Okay, yeah, I can see a couple of questions have popped up here. So we have a question here from, does it recognize any actions to be taken by the letter and direct them to a pharmacist, GP, or a nurse? Okay, so the way that would work is that the letters, you would tell it for particular letter types if you wanted it to have a particular action. So does it action, does it recognize any actions to be taken? No, it's not going to action the letter for you, but it will recognize, it will understand if a letter is confirming that an action needs to be taken, and then yes, it will direct it to the appropriate person, be it a pharmacist, a GP, or a nurse. So yes, it will do that. How does it recognize multiple hospitals written in a letter and use the correct one? We have numerous letters where we have this currently. Yeah, most people do. It can be very challenging. You will tell us in terms of that letter. and then we will tell it which letter. Because so what we do is MyBotGP will be taught to be pinned down to that particular letter from that particular hospital, and then we tell it what to look for at that time. And that's part of the training. And then when we have our sign-off meeting with you, we will present that to you, and then you will validate whether that's correct or not correct, and it will be adjusted and saved, and then it will know every time it sees that letter which which hospital to look for, whether it's the one at the top of the page, bottom of the page, whether they've written the name in the middle of the page. But invariably there is a pattern or a theme to that. Any other questions? Are mistakes covered by insurance? Yes. So the way that it works is if our tool doesn't work and it's our fault, then it's our fault. And of course, we can't have that. However, if you tell us to do something incorrect with a letter, then that's your fault. So for example, if you say we never need to see this particular letter, just file it. But again, in the review calls, that's going to be very unusual if that would happen. Does that make sense? So thank you. Good. So just to cover that off, if we tell you that you're buying a tool which is capable of reading a letter and then triaging it to an appropriate place, and it doesn't do it, that's obviously on us. However, if you tell us that these letters are not important and you never need to see them, and you do, then that would be on you. And it's no different to what you're doing internally with your staff, with the people who are managing the letters already, so they know what ones to look for. So what we do in our configuration approach is we will configure batches of letters, generally batches of about 50 letters to begin with, sit down with you, spend about an hour on the phone. You'll sign off those 50 letters, or whoever is responsible for your coding will sign off those letters and say, yeah, that letter goes here, that letter does this, that letter goes in that folder, this letter we push through a template, or some of our clients just want everything put in one folder. These letters we don't need to see, and then we will do that in front of you on the screen, save it, and then you've obviously got your audit logs and to double check while you're building confidence with the tool. Do we have any other questions?
Hi, I just wanted to ask one thing. Letters come from different areas, and some of the letters will have written as investigations are done, like an ECG is done, or a blood test is done, or an echocardiogram is done. Will these be recorded and coded?
So, Ange, do you want to take that one? Okay, fine. So I'll take that. So essentially, the way that it works is we wouldn't look at the individual detail within the letter, but the letter type. The letter type will be coded and then distributed to the appropriate person or team or folder where they would review that letter and then do the remaining. Does that make sense?
Thank you.
So the principle behind this tool is that there are two challenges to letter management, to document essentially. The first is the sheer volume of letters that you get, and getting them onto the system, validating them, and making sure that the right people see them. The second challenge is actioning the ones that require action. And what I mean by that, as you know, is reading it, summarizing it, picking out what needs to be done in terms of coding specific conditions or action or next steps and actions based on that letter. They're the two challenges. Now, there is nothing out there which can do the human bit yet. And I don't think there will be for quite some time. So what I mean by that is there's nothing out there that can read a letter, summarize it. There's a couple of tools that will hazard a guess, but they'll still give it to a person to make the final decision on that. So how can you help these teams who are massively struggling? Well, in our opinion, you just do everything else. So bringing it back to the beginning, you would be grabbing 39,000 letters a year for an 8,500 list, validating all those letters by itself 7 days a week, 365 days a year, filing them all against the patient record, removing the ones that you don't need to see, 111s, DNAs, negative retinopathies, any number of those, unless you do need to see them. Some of them will have a warning on there, and you can tell MyBotGP will recognize that and flag it. And then triaging the remaining letters that do need to be seen by a person to the appropriate person. So all of the rest of the work is done. And then you have, you know, coming in on a Monday after holidays, sick leave, people away, all of that type of stuff doesn't become an issue. It stops being an issue anymore because you have a physical automated platform in the background doing that entire job for you. And that's the principle of our letter management tool. So any other questions? Okay, brilliant. Well, look, we'll round things off now. If you have any questions after the call, please let us know. We will save this, put it onto our webinar channel, and then distribute it. We had quite a big registration for our webinar this time, but it's second week back in January, so people are generally quite busy. So we weren't expecting everyone to attend today, but we will distribute the video to everyone afterwards. And if you have any questions, please let us know. And thank you, Anita, and thank you. Lovely to meet everyone. And yeah, we look forward to hearing from you. Thank you very much.